Good afternoon. My essay was about addressing substance use disorder in nursing and how it impairs patient safety and just like overall work ethic and efficiency and effectiveness. So with this video, I just really want to address the issue that impacts patient safety, like I said, staff well-being, and just like liability due to substance use disorders among nurses. Research shows that approximately 10 to 20% of nurses will struggle with substance use at some point in their career. Despite this, many cases go unreported. This is not because the problem is rare, but because the system, as it currently exists, unintentionally discourages disclosure because a lot of nurses fear administrative punishment. From an administrative perspective, this creates a significant risk, one that affects not only the patient outcome, but also legal exposure, staff retention, and the overall work culture. Nurses operate in high-stress environments, long shifts, emotional strain, and frequent exposure to trauma. Over time, these stressors contribute to burnout, anxiety, and depression. When you combine this with direct and frequent access to controlled medications, the risk for misuse increases significantly. However, the most critical issue is not just substance use itself, but the underreporting of it. Nurses often hesitate to report themselves or colleagues due to fear of termination, loss of licensure, or being permanently labeled as unsafe. This fear creates a culture of silence where impairment may go unrecognized until patient safety has already been compromised. This places hospitals in a reactive position, responding to incidents after harm has occurred rather than preventing them in the first place. Historically, healthcare systems have relied on punitive approaches such as termination or disciplinary action. While these measures are intended to protect patients and deter substance use, they often have the opposite effect, driving the problem underground and delaying early intervention. There is strong evidence supporting a more effective approach. The alternative to discipline programs focus on rehab, structured monitoring, and a safe return to practice in an unjudgmental environment. These programs have been shown to encourage early reporting, reduce patient harm, improve long-term recovery outcomes, and retain experienced trained nursing staff. From a system standpoint, this is not only a patient safety strategy, but also a cost-effective workforce retention strategy in the face of ongoing nursing shortages. We must shift from a punitive culture to supportive, safety-focused culture. Substance use disorder should be recognized and treated as a chronic medical condition and not a moral failing. Second, we must implement clear, confidential reporting pathways. Staff must feel safe raising these concerns and knowing that the goal is early intervention support and not immediate punishment. Third, we should invest in early identification and education, training both frontline nurses and leadership to recognize warning signs such as medication discrepancies, behavioral changes, or increased absenteeism can significantly improve early detection. Fourth, we must address system-level contributors that increase the risk of substance abuse, such as chronic understaffing, excessive workloads, and limited access to mental health resources. These are not just operational challenges, but they are also direct contributors to nurse impairment and burnout. Finally, we must reinforce the role of nurses as both caregivers and patient safety advocates. While nurses have an ethical responsibility to report impairment, organizations also have a responsibility to respond in a way that is fair and compassionate. In summary, substance use disorder in nursing is not just an individual issue, but is a system-level patient safety concern that requires a system-level response. By implementing supportive policies, promoting early intervention, and reducing stigma, we can protect patients, support nurses, and strengthen our organization as a whole. This is not just about regulatory compliance, but also creating a safer, more transparent, and more sustainable healthcare. My name is Kevin Tay, and thank you for listening.